All right. Hey, everybody. Hello, hello. It's Monday night. And greetings to everyone in Transform 2022. It's a pleasure to be with you tonight. And we had been talking this month, of course, because it's February. It's the month of love and gratitude, right? And it's also the month where we pay specific attention to cardiovascular wellness. And had promised you just an amazing health lecture tonight by a renowned cardiologist. And at the last minute, we switched from Dr. Tamara Sachs to a cardiologist out of Ohio, and his name is Dr. Eric Goulder. And I have to tell you, I am so impressed with Dr. Goulder. Number one, because of his preventative approach to cardiovascular disease. And the information that he's going to share tonight is rare. And the reason that I love bringing him to this community is that in the Transform 2022 community, we pride ourselves on bringing you cutting edge information about health and wellness, but also cutting edge science about health and wellness. And so I'm going to tell you right now, Dr. Goulder speaks for about 30 minutes, and there are portions of his program where he gets pretty technical. But hang in there, because some of the things that he shares, I mean, literally blew my hair back today, and I'm in this arena all the time. So take some notes. Know that we're proud to bring you tonight on Transform 2022, Dr. Eric Goulder. So Kathy, go ahead.
Welcome to the Healthy Living Revolution Live. My name is Wendy Erdman. The Healthy Living Revolution is a movement of people who are taking healthy back. And we're offering this series to bring some simple solutions and education. Our speaker for this episode is cardiologist Dr. Eric Goulder. Dr. Goulder is a board-certified cardiologist and the founder of the Heart Attack and Stroke Prevention Center of Central Ohio. He grew up in Central Ohio and then graduated from the Oberlin College. He graduated from the Ohio State University College of Medicine and then did his internal residency and his cardiology fellowship at Riverside Methodist Hospital. He is board certified in internal medicine and in cardiovascular disease. Dr. Goulder has practiced what he would now call standard of care or end-stage cardiology for 20 years here in Central Ohio, and then for the last 12 years in Marietta, Ohio. During that time period, he practiced general and invasive cardiology. After being introduced to the Bale-Donine method of heart attack and stroke prevention, he has since devoted his practice full-time to a preventative approach to cardiovascular disease. The Heart Attack and Stroke Prevention Center of Central Ohio has been open for a little over a year and a half and is a collaboration between Dr. Goulder and his wife, Dr. Barb McClatchy. Their mutual goal is to knock cardiovascular disease off the top of the list as the leading killer in our country, where it has been for over 100 years. Together, Dr. Goulder and Dr. McClatchy enjoy touring on their motorcycle. They have crisscrossed the country from Bar Harbor, Maine to Key West, Florida, and west to the national parks in Utah and up to Yellowstone. While they are technically empty nesters now, their two golden retrievers help to liven up the house. It's a privilege now to turn it over to Dr. Goulder.
Thank you, Wendy, for that kind introduction. We're going to talk today about how we can make heart attacks optional. And we want you to join us in our mission, which is helping to knock cardiovascular disease off that top rung of the ladder where it's been as the leading killer in this country for the past 100 years. We want to help you take healthy back. So what are the statistics of heart attacks and strokes? So heart attacks remain the #1 killer in this country, as they have been since 1919. Someone has a heart attack every 40 seconds in our country, and somebody dies from a heart attack every minute. The average age for a man for a heart attack is 65, and for a woman is 72. So just when you get to that point in your life where you're going to kick back a little bit, relax, spend more time with the kids and grandchildren and travel more, get struck down by a heart attack or a stroke. The median survival for men having a first heart attack over the age of 45 is only 8.5 years, and for women, it's only 5.5 years. And it's the largest cause of premature loss of life. That's an average of 17 years. So what about strokes? It's very similar to heart attacks. It's the leading cause of disability in this country. Somebody has a stroke every 40 seconds. Somebody dies from a stroke every 4 minutes. Over 2,300 people in this country die from cardiovascular disease every day. And if you've ever been to Washington, D.C. and seen the Vietnam Memorial Wall, you know there's 58,000 men and women on that wall. And every 3.5 weeks, 58,000 people in this country die from cardiovascular disease. Every 3.5 weeks, we go through a Vietnam War worth of death, and then we do it again. So what are the classic risk factors for cardiovascular disease? Well, you know these. It's high blood pressure, diabetes, cholesterol, tobacco, smoking. And these were all developed from the Framingham study that we're going to talk about a little bit later. But if we just take one of these risk factors, and that's diabetes and obesity, and look at what's happened to this country over the past 20 years, these are CDC slides of obesity and diabetes by state in this country. And we're going to click through these maps very quickly, and you can see that we're going from relatively healthy to relatively sick very quickly in this country. Over the next 20 years, we're almost there. Now that's 2014, here's 2015. And if you compare this slide now to where the deaths occur in this country, or compare it to the beginning slide, you can see that we've gone from being relatively healthy to relatively sick, and a great deal more diabetes in this country. The CDC map by county of where deaths occur in this country by cardiovascular disease is very similar to the bottom slides. So we know that Juice Plus improves insulin resistance. There's a CDC report out that states that there are 28.5 million people in this country with diabetes who know it and are being treated. There are another 100 million people in this country who either have insulin resistance or diabetes, don't know it, and is not being treated. 100 million people, that's almost a third of the country, has either insulin resistance or diabetes. So a heart attack or sudden cardiac death is the presentation for half the cases of coronary artery disease. Really, the lucky people are the ones that get symptoms or see their doctor and get a stress test done and find out they've got a problem and get treated for it. The other half of the cases, it's either a heart attack or just dropping over dead. So here's several people that we all know. David Letterman, the old Tonight Show host, had a heart attack and five vessel bypass surgery. He was only 52 years old. James Gandolfini, the lead actor of The Sopranos, had a heart attack and died at age 52. John Candy, the comedian in many films, and had a heart attack and died at age 43. Bob Harper, the celebrity personal trainer, had a heart attack at age 52. And here's probably the most ironic of the bunch, Dr. John Warner. He's the immediate past president of the American Heart Association. He was at the big American Heart Association annual meeting in November a couple of years ago, and he came back up from his spin class at 6:30 in the morning and dropped over dead in the hotel room. Fortunately, his family was there. His daughter had been trained in some non-breathing CPR, and he got resuscitated and survived. And we're going to talk about him a little bit more toward the end of this talk. So that begs the question, why do people not know that they have arterial disease? All these people had arterial disease, and they had it for years before they had an event, and nobody knew. Well, here's what a normal coronary artery looks like. It's got a thin, one-cell thick lining layer here called the endothelium, and this is not, we used to think it was just a lining layer, but it actually plays an active role in controlling blood flow to your arteries. There's another thin layer here called the endothelium.
Okay,
Cut. Start right there. I'm good.
Sure.
Okay. There's another thin layer right here called the intima. This is where all the bad things happen in the artery. And then there's a muscle layer, and then the outer arterial wall, which is fibrous connective tissue and elastic tissue. And so if we look at a picture of what goes on in the arteries, this crusty old blockage, all this stuff here, this is all calcification, scarring, fibrosis, collagen, all this stuff happened in this thin little layer right here. And this is about an 80% blockage. This is all that's left of what we call the lumen, or the opening where the blood flow goes through. And this is a very stable old blockage. It's probably not going to go anywhere. Nothing bad is going to happen to it probably, On the other hand, this blockage over here is probably about a 25% blockage of this arterial wall. There's no calcification here. This is all full of cholesterol and the inflammatory response to the cholesterol getting into that lining layer, which is white blood cells and proteolytic enzymes, enzymes that can dissolve proteins and kill bacteria. And it's just covered by this thin fibrous cap right here. Here's that blow up of that thin fibrous cap, and these proteins in here, these enzymes in here can dissolve this thin fibrous cap, and that's what can cause the artery to rupture. So the next question is, how bad is the blockage before a heart attack occurs? So this is a great study. It's a meta-analysis. So they took 4 smaller studies that were very similar in design, combined them to get a more powerful statistical result. And the question in this study was this: how bad is the blockage just before the heart attack occurs? So they got a bunch of people to volunteer to get a heart catheterization done every 2, 3, 4 years. And finally, when enough of them would come back in with a heart attack and they looked back to see how bad that previous blockage was, they had enough information to publish a study. And what they found was 68% of the time, the blockage that was causing the heart attack was 50% or less. 86% of the time, the blockage that was causing the heart attack was 70% or less. So only 14% of the time was the blockage that was causing the heart attack bad enough to result in a positive stress test. The blockage has got to be about 70% before a stress test is going to become abnormal. 86% of the time, the blockage that caused the heart attack was so mild that a stress test would never pick it up. So Dr. Dean Berman, who's one of the developers of the radionuclear stress test, like a cardiolite or thallium stress test, understood this when he said 20 years ago that patients who have normal imaging stress tests frequently have extensive atherosclerosis. What he meant by that was the flow through the artery on this axis only starts to drop off when the blockage gets to be about 65 to 70%. So what he said was, a lot of people who have normal imaging stress tests frequently have 20, 30, 40, 50, 60% blockages that the stress test will never pick up. So 2/3 of the time, the blockage that results in a heart attack narrows the arterial lumen less than 50% over here, okay? It's not the blockage that causes the heart attack, it's the blood clot that forms when this thin fibrous cap ruptures and your body tries to heal it. And that blood clot then plugs up the entire artery and causes the heart attack or stroke. So how does the standard of care estimate your risk? Well, we rely on something called the Framingham risk score, or a cousin of it. There are many more risk scores out there now that are all based on a Framingham type risk. And they're looking at, it's based on a study started in Framingham, Massachusetts back in 1948, a little town of 5,200 people. Doctors from Boston went over there and did a history and physical, did blood work, did an EKG on every man, woman, and child in town, came back and did it every year until finally about 10 years down the road, they had enough information. They could look at their statistics and found out that, yeah, it's high blood pressure. Those people are having more heart attacks. People with high cholesterol having more heart attacks. Smokers are having more heart attacks. And so this assumes, when you use this risk score, this assumes that you are the mean of some large bell-shaped curve. And you're not the mean of some large population group. You're your own group of one. And to treat you as an individual, we really need to know more about you, including something about your genetics. And so we want to know about, if you have 2 or 3 different genes that put you at increased risk for cardiovascular disease. There's a gene that we look at to see how you metabolize lipids, fats in your blood, because not everybody does the same, and that's important for our picking a diet for you, because not all diets are going to work for all people. And then we also need to, there are genes that we need to know about because they reflect how you respond to infections. And so if you listen to Dr. Barb McClatchy's talk, my wife's talk that she did about a month ago, she talked about that oral systemic connection and how your individual response to those infections can play a role in your development of heart disease. And so that's why we practice together, because we really need to know all about these different root causes that can play a role in both oral disease as well as cardiovascular disease. So then the next question is, how reliable is that Framingham risk score? Well, a doctor did a great little retrospective study. He took 222 people who came in with heart attacks, and they were people coming in prematurely. So as I said before, the average age for a man for a heart attack is 65. In this study, the men were less than 55. The average age for a woman for a heart attack is 72. In this study, they were 65 or less. And then after they came into the emergency room going, I definitely have arterial disease, I'm having a heart attack, he applied this Framingham type risk score and found out that it missed 82% of the women and 66% of the men. So these risk scores are not very reliable, and still the standard of care says, you know, guidelines handed down by the American College of Cardiology and the American Heart Association says, do a Framingham style risk score and see what their risk is. So that's not a very good way to estimate your risk if we're missing that many people. So we're going to try detecting subclinical carotid or coronary artery disease to find quote unquote healthy people who are at increased risk if we find evidence of disease there. And that can certainly change how we're going to treat you. You know, if the Framingham risk score says you've got a 2, 3, 4% risk of having a problem, your doctor's probably going to tell you you're doing great and let you go. But if we find evidence of having disease, that's a totally different picture. So we need to look for disease. And we know that we can't use a stress test because it's often wrong for various reasons. We can do a heart catheterization on you. Well, that's invasive. There's risk of complications associated with it. And really the problem with both of these approaches is they're just looking for blockages that are bad enough to need fixing. They're looking for blockages that would require a stent or bypass surgery. They're not really looking for mild asymptomatic disease. So let's look somewhere else. Well, we can look in the carotid artery. It's right under the skin. It's right in your neck, right here. It's easy to image. And the anatomy is there's the common carotid artery down here. It branches just below the angle of your jaw here into the external carotid artery, which goes up to the muscles of your face. Internal carotid artery then goes on up to your brain. And so we're going to use an ultrasound scan. It's called the carotid intima media thickness test. And it's just a simple 15 or 20 minute ultrasound. There's no needles, there's no contrast involved. It's safe, it's non-invasive, it's reliable, repeatable. The American Heart Association said all this 20 years ago, and still insurance does not pay for this test in this country. It's pretty inexpensive, but it's just silly that things are that far behind. So again, the CIMT is looking at the arterial lining. It's not looking at the flow. You remember the stress test that we talked about is totally dependent upon the flow through the artery. We're not going to look at the flow. We're going to look at what's going on in the lining of your blood vessel. And so here's what it looks like. Here's in this picture, your feet are going to be down this way, your head's up this way. Here's the common carotid artery coming up your neck. At this line, it's widening out into what we call the carotid bulb, just before it branches right here into the external and internal carotid arteries. And we're going to look at two things. How thick is this lining layer down here in the common carotid artery? And there's a normal for age. It gets thicker as we get older. It's a little thicker in men than women. But if it's thicker than it should be, that's telling us that there's some cholesterol and inflammation building up in there. It's not plaque yet. The definition of plaque is a 1.3 millimeter thickness. And if you follow this lining layer out here farther, you can see it gets thicker out here. And this is definitely some soft plaque out here in this artery. Here's another example of some soft plaque in a different artery. And so the question is then, what does finding that mild asymptomatic blockage mean? We know that 86% of the time it's those milder blockages that are going to cause trouble. So let's look at that. So here's a study where they took 10,000 healthy people. Nobody had high blood pressure, diabetes, or cholesterol. There were men and women in the study, ages 35 to 65 years old. Everybody got a baseline carotid and femoral artery scan. Nobody got any treatment for 10 years because this was a natural history study. They wanted to see what happens if we don't treat arterial disease. So the average Framingham risk score, the risk for the 35-year-old men and women would be about 1.5%. The 65-year-old women would be about 5%. The 65-year-old men, 10%. The average Framingham risk in this entire group was about 3, 4, 5%. And here's the baseline pictures they got. There were almost 8,000 people who had normal arteries. There were 930 people that had thickening of the lining, but not plaque. There was another smaller group, 611, who had plaque, even though surprisingly, it was surprising because they did not have high blood pressure, diabetes, or cholesterol. And there was a small group that had what they called stenotic plaque in this group, which was a 50% or more blockage. So what happened? So now we're going to follow these people for 10 years. Nobody gets any treatment. And here's what we see. If you had no blockages, you had normal arteries, nothing happens to you. One person out of 8,000 had an event. If you had thickening of the lining but not plaque, now the risk goes up to almost 9%. So you remember that was a 3.3 to 5% risk entire group. So it doubled or tripled your risk of having an event. And if we found plaque in somebody who had no high blood pressure, diabetes, or cholesterol, then it was a 40% event rate, not 3, 4, 5%, or even take the worst case, it was if they were all men in this group that were 65 years old, they would have a 10% risk, but no, it went up to a 40% risk. So now that we have found mild asymptomatic disease, what are we going to do? How are we going to treat that? Well, we know it's inflammation that drives that whole arterial disease process. It's inflammation that plays a key role in the development of the plaques and the progression of the atherosclerotic disease. It's inflammation that destabilizes those plaques and promotes blood clot formation and plaque rupture. And so the next question obviously is, are my arteries inflamed? And we have several tests that we do on our patients routinely to look and see if their arteries are inflamed, and if they are, we're going to get on that. So by finding root causes, what the whole bunch of things that can drive the whole inflammation process, and optimally treating them, we can get that inflammation, that fire in the arterial wall to resolve. And so here are all the root causes that we look at, things like obstructive sleep apnea, low vitamin D, and inflammatory diseases, autoimmune diseases like rheumatoid arthritis and Sjogren's disease, lupus, insulin resistance. I told you, 100 million people in this country are insulin resistant and don't even know it. And then there's the dental problems, the periodontal disease and endodontic disease. And that's why my wife and I are practicing together, because while I'm responsible for all these things, she's responsible for finding and treating these, because I can't do it. That's not what I was trained in. And then if we find all these things, treat them all optimally, then everything goes back towards normal. If you've got soft plaque in your artery, it shrinks down and calcifies and stabilizes. If you just have a thickened lining that's inflamed, that can go back towards normal. It can go back to being a normal lining. So we can actually stop the process and reverse it. And so there was a great study that came out in Circulation, American Heart Association journal, back in 2013, that said there's a direct connection between oral pathogens, the bacteria in your mouth, both periodontal and endodontic, that's root canal lesions, and acute heart attacks. So how are we going to treat all this? Well, lifestyle modification is the cornerstone of therapy. We cannot outprescribe lifestyle. Okay, that's the most important thing I have to get my patients to do is make some changes in their lifestyle to help get that inflammation down. We want you to help take healthy back. So here's the American Heart Association 7 essentials for heart health, and they're all very reasonable. It's not smoking, it's having a BMI under 25. BMI is body mass index. If you don't know what yours is, it's based on your height and your weight, and you can Google what the calculation comes out to. A normal BMI is 19 to 25. Over 25 is considered, over 25 to 30 is considered overweight, and over 30 is considered obese. 150 minutes of moderate or 75 minutes of vigorous exercise per week, a total cholesterol under 200, blood pressure under 120/80, fasting blood sugar under 100, and then diet. And at least 4 of these, so getting more fish in your diet, cutting back on red meat, increase fiber and whole grains in your diet. And this is the one that I think people have the most trouble with, and one of the more important things, and that's that 4 1/2 cups servings a day of fruit and vegetables. And if you ask most people, well, are you getting that? Well, yeah. For lunch, I had a salad for lunch, and it had a couple carrot strips in it. There was a couple slices of tomato and a slice of cucumber. And for dinner, I had broccoli. Well, that's just not adequate. You're not getting what you need. And so we strongly encourage our patients to use a Juice Plus enhanced diet. Juice Plus is just freeze-dried fruits and vegetables. They're vine ripened. Today, part of the problem with our fruits and vegetables is they've lost a lot of their nutrient content. Compared to 30, 40, 50 years ago, there's been a loss of a lot of nutrition because of loss of the fertility of the soil, because things are not picked vine ripened. We get our fruits and vegetables from all over the country, all over the world now. So they have to be picked before they're ripe so that they can survive the trip to wherever you live to get them. So it's really more like 7 to 13 servings of fruits and vegetables you need a day. There's, the quality of the food is decreasing. There's, trans fats, there's pesticides, GMO, synthetic vitamins, there's artificial coloring, growth hormones, antibiotics in the food. So it's harder to get good quality food. And it's so important for us because fruits and vegetables is where we get our antioxidants from. And while we are, so what are antioxidants? Antioxidants are things that can combat the free radicals that are occurring or we're putting in our body all day long. While we're just, we're just living and metabolizing everything we do, we're creating oxidative stress for our body. What that means is free radicals are molecules that have lost 1 or 2 electrons and they become very reactive. And so the antioxidants are molecules that have an extra electron or 2 to give up and can stabilize those free radicals. And those free radicals, when they're floating around, they react with all sorts of things, including your DNA, and can play a role in aging. So Juice Plus for us is, we highly recommend it to all of our patients because it gets them 30 fresh fruits and vegetables every day. And it's easy to take, and it's not expensive. And it's a great way to make sure that you're getting that one of those important parts of that lifestyle modification. There's hundreds and hundreds of phytonutrients in fruits and vegetables, as opposed to just taking a multivitamin, which, by the way, taking multivitamins has no beneficial effect to cardiovascular disease. It'll decrease your risk of cancer a little bit, but you may get 6, 8, 10 vitamins in a multivitamin, but nothing like the nutrients you get out of fresh fruits and vegetables. And the real reason we back fruit Juice Plus in our practice is because there are 39 randomized, placebo-controlled, double-blind studies done in major universities all over the world, published in peer-reviewed journals like JACC, which is my journal. That's the American College of Cardiology journal. But Clinical Journal of Periodontology and Nutrition Research, and all these peer-reviewed journals, which say that Juice Plus is beneficial in a multitude of ways. And for me, it improves cardiovascular wellness, it decreases inflammation, improves the immune system, keeps you from attacking your DNA. For my wife, for Barb, it improves gum tissue. It decreases bleeding, it decreases pocket depth. You don't have some place for those bacteria to grow in your mouth. It improves insulin resistance and decreases abdominal fat mass, which is a risk for cardiovascular disease. So we love Juice Plus. And just a couple examples of some Juice Plus articles, studies that say is beneficial for you. This first one was published in the British Journal of Nutrition, which is talking about giving people Juice Plus for 8 weeks, and then looking at measures of oxidative stress, and that's the carboxy proteins and oxidized LDL. That's the LDL that's reactive and gets into the intima and causes trouble. TNF-alpha, that's a tumor necrosis factor alpha, interleukin-6. These are both inflammatory cytokines. Cytokines are little signaling proteins that tell your body to do something. In this case, it's telling your body to mount an inflammatory response. And they also looked at the capillary blood flow before and after Juice Plus, and with and without exercise. And what they found was taking Juice Plus decreased oxidative stress, it decreased these carboxy proteins, it decreased oxidized LDL, decreased tumor necrosis factor alpha, and improved blood flow. Exercise and Juice Plus together independently each also improve capillary circulation. So it does all the right things for inflammation and for oxidative stress. This other article was published in the Journal of American College of Cardiology, talking about the effect of Juice Plus on, now it gets a little complicated, I'm going to explain it to you, okay? Impairment of flow-mediated brachial artery vasoactivity. So here's what they're talking about. We know that if you eat a high-fat meal, it's going to decrease your artery's ability to constrict and relax for the next 4 hours. And so what they did in this study was they took a bunch of people and put half of them on Juice Plus, half of them on placebo, and they looked at this flow-mediated brachial artery dilatation. This is a simple test where they just put a blood pressure cuff on your arm, leave it blown up for a while, let the blood pressure cuff down, and they look at what's called the hyperemia, which means the increased response of your blood vessels to having been hypoxic for a little while, for having not gotten enough blood flow for a little while. And so your body over-responds to that, and that's measured just by using an ultrasound. And so what they found was this flow-mediated brachial artery dilatation, measured before and after that meal, showed that Juice Plus blunted the high-fat meal's ability to block that vasoreactivity. So this is a measure of endothelial function, because as you remember, I mentioned at the beginning that the endothelium produces nitric oxide, which is what makes your blood vessels react. dilate and get larger. So Juice Plus helps with endothelial function. That's huge. So this is, all these things are important parts of lifestyle. It's really the most important thing I counsel my patients on is lifestyle. So what do you look like the day before you have a heart attack or a stroke? Well, you know, you don't plan that you're going to have a heart attack or stroke. Nobody wakes up in the morning and says, I'm going to have a heart attack today. I better be looking good because I'm going to the hospital. No, you're just doing your usual daily activities. You're with your friends and family. You're shopping. You're walking the dog. You're enjoying life. If you were David Letterman, you were getting ready to record the next show of the Tonight Show. If you were James Gandolfini, you were working on the next episode of Sopranos. John Candy was probably planning his next big movie. Bob Harper was exercising in the gym. He was riding on an exercise bike and fell over dead and got resuscitated by two family practice doctors who happened to be in the gym at the same time. And John Warner, as you recall, dropped dead from a heart attack in his hotel room, got resuscitated by his daughter and a couple of and a pediatric cardiologist who was down the hall. And I think the most important thing about John Warner's story is that after he recovered from his heart attack and he was giving interviews to all the major news outlets, CBS, NBC, CNN, he said that he knew that he was preordained or destined to have a heart attack because when his first child was born, he looked around the room at all of his family members who were there to welcome his first child into the world, and he noticed that there was not a single male member from his side of the family over the age of 60. So he thought that he was destined to have a heart attack. Unfortunately, what he didn't know is that heart attacks are optional. So, and here's another classic example, Tim Russert, who you all probably remember from the NBC Sunday morning political talk show, Meet the Press. He had high blood pressure and high cholesterol. He was being treated for both of them, and it was that standard of care goal for both of these. He was on an 81 milligram aspirin appropriately, and he had just passed a normal stress test. And now you know that if you pass a stress test, all that tells you is you don't have a blockage that's 70% or more. You can have one of those milder blockages, and so many times that milder blockage is what causes the heart attack or stroke. Then, after passing a stress test with flying colors, he dropped dead of a heart attack at the NBC studios just 8 weeks later. He was only 58 years old. So what's our take home today? What did you learn? Inflammation is what drives the arterial disease process. The key to prevention of arterial disease is finding mild, asymptomatic disease rather than waiting until you have symptoms or an abnormal stress test. Working with a complete health dentist like my wife, Dr. McClatchy, who understands the oral systemic connection, is paramount to finding all the sources of inflammation to optimally treat. And lifestyle modification is huge in what we do. And that includes a Juice Plus enhanced diet, which is critical to decreasing inflammation and oxidative stress to help slow, stop, and even reverse the arterial disease process and thus prevent heart attacks and strokes. And so now you know heart attacks are optional, and if you know that, then you know what Maya Angelou says, which is do the best you can until you know better. Then when you know better, do better. So please join us in our mission to help knock cardiovascular disease off that top rung as the leading killer in this country. And please contact the person who gave you the link to this video so you can learn more about Juice Plus.
Wow. Is that a wow or what? Did I tell you? You can't, I mean, it was just unbelievable. I mean, his quote should be a Juice Plus quote. Heart attacks are optional. Wow. So for those of you in the Transform 2022 community, there's about 1,800 of us. This is a video that you have access to. You can invite friends and family to be a part of our Transform 2022 community, or you can simply request this link and we will get it to you. I hope that you appreciate this information. I think the other thing that really spoke to me was that 100 million people in the United States are insulin resistant and they don't even know it. And that the solution is lifestyle. And the foundation of that is good nutrition, fruits, vegetables, and berries. So I'm glad that you're able to join us tonight. Thank you for being a part of the Transform 2022 community. I hope that you found that this was valuable information, and we look forward to visiting with you real soon. So from everyone and all of us, peace and blessings. Have a great evening. Good night.
Night.